Mihira, we need to discuss the recent outbreak of Nipah virus in the neighboring state. It's crucial that we're prepared to handle any potential cases here.
Absolutely, doctor. I've been following the news closely. What are the main symptoms of Nipah virus?
The initial symptoms can be similar to influenza, including fever, headache, and muscle aches. However, as the infection progresses, it can lead to more severe symptoms like encephalitis, seizures, and respiratory distress.
That sounds serious. How is Nipah virus transmitted?
Primarily through contact with infected pigs or their bodily fluids. It can also be transmitted through contact with the saliva, respiratory secretions, or cerebrospinal fluid of an infected person.
Are there any preventive measures we can take?
Maintaining good hygiene, avoiding contact with sick animals, and using personal protective equipment are essential. Mihira, if we suspect a case of Nipah virus, it's crucial to isolate the patient and notify the health authorities immediately. Mihira, if the doctors decide that surgery is the best option for you, there are a few steps we'll take to make sure you're fully prepared and safe. Before the procedure, we'll guide you through some preoperative preparations. That usually includes fasting for a number of hours beforehand, taking some blood tests, and checking your vital signs. You'll also meet with the anesthetic team, who will explain exactly how the anesthesia works and answer any questions. Their job is to keep you safe and comfortable throughout the surgery. After the operation, you'll stay with us in the ward for monitoring and pain management. We'll keep a close eye on how your leg is healing and support you with medication if needed. Soon after, our physiotherapy team will begin working with you, starting gently, to get the muscles moving again and to help prevent stiffness or weakness. Rehabilitation is a gradual process, but it's essential to helping you regain strength and mobility in your leg. We'll also give you advice on using walking aids, managing daily activities, and safely increasing your activity level over time. Now, in terms of what's next, your doctor will be coming to see you shortly. They'll review your scan results with you, explain in detail whether surgery is necessary, and talk through the next steps in your treatment plan. It's a good time to bring up any questions or concerns. Nothing is too small. The more you understand, the more in control you'll feel. And I'll be nearby as well, so you're not going through this alone.